Hello everyone, Dr. Fink here. Today we will talk about a steroid cycle without any side effects. Quick disclaimer, this is not medical advice, this is entertainment only. So many of you are aware that steroid cycles come with a lot of side effects, and one of the main side effects steroid users encounter is infertility. Okay, so why does this happen? If somebody is injecting or taking oral steroids, then introducing androgens exogenously, so from the outside, will shut down their own production of testosterone because the brain senses androgen levels, so testosterone levels in our body, and sees, oh, we have enough androgens, we have enough testosterone, so we'll stop producing our own testosterone. And this happens at the level of the brain, in the hypothalamus and pituitary gland, and it sends the signal down to the testes where testosterone is produced. All right. Hence, people who take testosterone or other anabolic steroids will shut down their own production and may become infertile in the long run. Okay. So, for those who want kids in the future, who want to prevent becoming infertile, there's another way to naturally, not naturally, but internally trigger more testosterone production, okay, without having the side effects of shutting down your own production. And this drug is called HCG, okay, HCG. And this stands for human chorionic gonadotropin. This drug has been developed to trigger ovulation in females. But if it is used in males, it will mimic the hormone LH. Remember when I was talking about the brain signaling the testes to produce testosterone? Well, this hormone, LH, luteinizing hormone, is exactly involved in that precise step. It tells our testes produce testosterone. So if somebody injects HCG, our body will think we have more luteinizing hormone, more LH, and hence produce more testosterone naturally. Okay, so our body will increase its own production in our testes and also increase sperm production. So we don't have the side effects of shutting down. We have actually quite the opposite. We are increasing the production of our own testosterone and sperm. So for those who uh, want kids in the future, who want to keep the fertility, HCG is a great way to increase testosterone, which comes hand in hand with increased performance and muscle mass without having the side effect of becoming infertile like on steroids. Okay, and HCG is also less prone to have side effects in terms of increased red blood cells, acne, gynecomastia, etc. Okay, because with HCG, your body is just triggering your own production. It's increasing its own production, so it will never go to levels seen with anabolic steroids. If somebody injects from the outside directly testosterone, let's say 500 milligrams or 1,000 milligrams per week, then the levels of testosterone will be so high that a lot of side effects will arise. Okay, the levels could be 3,000, 4,000, 5,000 nanogram per deciliter in the blood. Okay, whereas our normal levels should be somewhere between 300 to 1,000. With HCG, since we are naturally triggering more testosterone, our levels will probably be around 7 to 1,000, 100,000, 200 nanograms per deciliter, which is basically exactly where we want to be. It is that healthy, high range of testosterone without overshooting and without having those harsh side effects seen in supraphysiological testosterone levels, such as seen in anabolic steroid usage. Okay, so that's why it is a pretty safe compound, because it is very hard to take too much, because your body is basically regulating itself how much testosterone you produce. In fact, it doesn't make much difference if you take 500 IU or 2000 IU, because there's this switch that tells your testes to produce more testosterone. And this switch is usually reached at the 500 IU level. Okay, so 2000 IU will also trigger that same switch, but it's not needed. Okay, 500 is usually enough. So dosage, timing of HCG. HCG is a water-based solution, and the half-life is shorter. It is around 24 to 36 hours. That's why it is usually recommended to inject every other day or 3 times per week. And for the dosage, 500 IU should be sufficient to trigger testosterone production. Okay, so there's another way to use HCG, and that is to recover from steroid usage in a PCT, okay, to recover your fertility. And in this case, higher dosages, such as 2000, 3000 IU, might be recommended. But for testosterone increasing as a cycle, okay, 500 IU should be plenty every other day or 3 times per week. Okay, so I mentioned in the beginning, it's steroidal without side effects, but actually HCG is not a steroid, but it is mimicking basically a steroid cycle in the way that it increases testosterone levels. Okay, so for those who don't want the harsh side effects of anabolic steroids, but still want improved muscle mass, strength, and mood and libido, then HCG can be a very good option to keep in mind. Okay, so again, protocol wise, 500 IU every 3 days or every other day, and it is usually in a water-based solution, intramuscular, very easy to inject since it is water-based, and this should give you, let's say, every other day 500 IU testosterone, serum testosterone levels of 700 to 1200 nanogram per deciliter about. Okay, that everybody's individual, but some previous research showed that it might be in that ballpark. Okay, so which is not too high, it is not low, it is perfect for building muscle and be healthy. All right, and then duration of HCG cycles is also something I want to touch about. So duration, it shouldn't be too long. The body might desensitize to the hormones, to the stimulus. So keep it shorter, a couple of weeks, and then get off HCG and then repeat might be the way to go. Okay, so this is it about HCG. I call it an option for a steroid cycle without side effects, since it is increasing, let's say, optimizing testosterone levels without side effects. So very beneficial actually for people who want to have more muscle mass, more libido, better mood, and is mainly very safe. Okay, so this is it about HCG. I hope you enjoyed the video. Please let me know what you think in the comments down below. Thank you for watching.